Hello, and welcome to the GRACE podcast series. My name is Denise Brock, and I am the Operations Director for the Global Resource for Advancing Cancer Education, or GRACE. In this podcast series, we interview patients, advocates, and healthcare professionals to provide the most updated information for our community and to highlight important issues facing those dealing with a cancer diagnosis. We hope you find this information valuable. For questions or comments, please visit us at cancergrace.org.
Hi, everybody. Thank you so much for joining us. My name is Maria Christian, and I am the head of programs and partnerships here at GRACE. I am very thankful to be joined today by Dr. Medhavi Gupta.
Thanks, Maria, for having me.
Thank you so much for being here. I know today we're going to talk a little bit about breast cancer and the importance of testing and screening. So we'll just go ahead and jump right into it, if that's okay with you.
Of course.
Okay, so to begin with, could you tell us how common breast cancer is in the U.S.?
So in the United States, breast cancer actually is the most common cancer in women after skin cancer. And moreover, it is the second most common cause of cancer death in women after lung cancer. Based on the recent estimates by American Cancer Society for the year 2022, approximately 280,000 women are expected to be diagnosed with breast cancer this year alone. And out of these, about 40,000 women will die of breast cancer. If we talk for an average risk woman, there is about 1 in 8 chance that a woman would develop breast cancer in her lifetime.
As you explained, breast cancer is not only a common cancer among women, but also a common reason for cancer death. What can women do for early detection of breast cancer?
So studies have shown that getting annual mammograms are one of the best tools to detect breast cancer at an early stage. And when cancers are detected at an early stage, there are 2 main advantages. Firstly, patients are less likely to need aggressive treatments, be it aggressive surgeries like mastectomies, whereby you remove whole of the breast, or even aggressive systemic medications such as chemotherapies. And I think more importantly, we know that if breast cancers are diagnosed at an early stage, they are much more likely to be cured of breast cancer. So different international societies have different recommendations for breast cancer screening, but in general, for an average risk woman, the recommendation is to start mammograms at the age of 40 years and repeat them annually. Now, there may be some women who are at higher risk for getting breast cancer. It could be because they had a history of breast cancer or someone in their family had breast cancer. There could be known genetic mutations in the family, such as BRCA mutations, or patients could have received radiation therapy to their chest wall in their earlier years. So for these high-risk women, the recommendation is to start screening early at around the age of 30 years. And usually patients are recommended not only to undergo mammograms, but MRI in addition to mammograms. So my suggestion would be talk to your doctor, be it at your annual visit or any regular visit, and your doctor should certainly be able to guide you as to what your risk is in terms of getting the breast cancer, at what age you should start the screening, what screening tests are the best suited for you, and how to schedule them.
Thank you again for joining us. This podcast was made possible by the generosity of sponsorship from our friends at Lilly and Exelexis. Please like and follow us on Facebook and Twitter. Send us feedback, share your story, donate, and visit us for more information at cancergrace.org. Thank you for listening.